Hello, this is Dr. Gabe from First Lake MRI, and this is a 65-year-old female with complaints of back pain and shooting pain worse in the right leg, and she has what we call a synovial cyst that's coming out of her facet joint in back, and it's going into the spinal canal and causing her symptoms. So these facet cysts are pretty common. Sometimes they poke off the back of the facet joint, and sometimes they come off the front. She has a little synovial cyst back here, very hard to see behind this facet on the right. Here's the left facet joint. The facets are in the back. There's one on the left and right, and they lock the vertebral segments together. This is the vertebral body here. We can see from a side view, if I go to mid-body, here's going right through the vertebral body. Here's the vertebral body. And if we roll off to the sides, we see a facet joint in back. And this is that facet on the right and back. We're going to go to the left side. Here's a facet in back. Here's the facet in back to get the anatomy down. Now we're going to go to this view. We can see, let me zoom it on up here. We see a little round area that's white. We're really hyper intense on this. We call this a hyper intense T2. T2 is the sequence where fluid is bright. So we know that this is very bright, so it must be fluid signal, which is compatible with a small cyst. The patient also has some fluid here in the back of the subcutaneous fat, just dependent edema back here. Also, we see that this vertebral body L4 is slipped forwards relative to L5, so we call this subluxation or spondylolisthesis. So we have some slippage, we have a cyst. If we look on these views here, these axial images, we're going to look at that disc level. There it is. So there's the cyst. Let me zoom that on up. That round thing here is the cyst, and it comes off of this facet joint. The facet joint is a synovial line joint, and the synovial cysts can protrude forwards into the spinal canal, like in this case, and cause a severe central stenosis and pinch the nerve on the right here. Also, they have an enlarged facet on the right and an enlarged facet. We call it facet arthropathy with hypertrophic changes, which means it's just enlarged. Also have this area here. This is thickening the ligamentum flavum. There's a ligament back here. So this is pushing on the left. The cyst is pushing on the right, so I have a severe central stenosis. There's no room. All those nerves are getting flattened and compressed, so this is going to require surgery to open that back up and then try to help fix this slippage, because the slippage is pretty significant and it's just going to get worse over time. So a synovial cyst, not a disc herniation, that is conspiring along with this facet arthritis and slippage to cause a severe central stenosis and cause her shooting symptoms. She also had some slippage at this level here between L1 and L2, but it's backwards, and there's not really significant spinal canal stenosis. It's still pretty open. And she also had this one other incidental finding. This is her uterus, and this bright area is the endometrium. She had thickened endometrium, so that can be a worrisome finding. And so she's gonna have to have an ultrasound. But again, a synovial cyst resulting in severe central stenosis and her right lower extremity radiculopathy. Thank you very much.